What is a periodontist?
That's a good question. Periodontics is a specialty that is initially originated to target and treat periodontal disease. Periodontal disease is probably the number one disease in the oral environment in all of our communities throughout the world that leads to tooth loss. Not only to tooth loss, also leads to systemic complications, and there's a lot of research that correlates the oral with the systemic connection, right? What does that mean for our general population? It means that because we have an infection in our gums, this infection goes through your entire system and could have a direct relationship with heart disease, pulmonary diseases, Alzheimer's, and many other aspects that happens in our body because there is an inflammatory disease as many others. Now, periodontal disease and periodontists treat that disease. The downside of this is that periodontitis, which is the gum disease or periodontal disease, is a disease that today, after many, many years of research, we still have no cure for that disease. So the problem with this is that we need to treat it to try to slow down the progression of the disease, but at one point or another, we may end up facing the need of removing those teeth because there's not enough bone support because the disease eats the bone away around the teeth. So along with the practice of periodontology, there is a little bit of overlap with our colleagues in oral surgery because the periodontics and oral surgery are the only two surgical specialties of dentistry. We perform surgical interventions in our patients to deal with periodontal disease and try to regenerate bone whenever we can do it. And we also perform implant treatment, bone regenerations, and everything else that is needed. So as our colleagues, the oral surgeons, but we don't focus so much in the intervention of accidents or malformations or hospital interventions and things like that, as our colleagues will do. So actually we do have a very good relationship in many cases, and some of my best friends are oral surgeons, because when we collaborate, instead of trying to overshadow to one another because we overlap in some of the procedures that we do, that collaboration has been very fruitful for us because we both benefit from either side of the story. And they receive a lot of patients from us, and we receive patients from them, and we treat them as a multidisciplinary approach.